RFK Jr.'s new food pyramid is insane. Scientists are freaking out. 1 month ago, the United States government released new dietary guidelines that are about to change what 330 million Americans eat. What your kids eat at school, what hospitals serve to patients, what the military feeds our troops. And the nutrition establishment is absolutely losing their minds. Robert F. Kennedy Jr., now heading the Department of Health and Human Services, just flipped the food pyramid upside down. Red meat at the top, full-fat dairy encouraged, butter back on the menu, and a declaration of war on the low-fat dogma that's dominated American nutrition for half a century. Sounds great, right? Finally, someone challenging the failed guidelines that gave us an obesity epidemic, a diabetes crisis, and a generation raised on processed carbs disguised as heart-healthy food. But here's the problem. These new guidelines are a complete mess. They contradict themselves. The advisory panel behind them had financial ties to the beef and dairy industries. And while RFK Jr. claims to be ending the war on saturated fat, the fine print still tells you to limit it to 10% of your calories. That is the exact same recommendation from before. Stanford scientists are calling it dangerous. Nutrition experts from Columbia and Tufts are demanding it be withdrawn. Parents are furious about what this means for school lunches, and the food industry is scrambling to figure out how to cash in. So what's actually in these guidelines? Who profits from them? Are they based on science or corruption? And most importantly, should you actually follow them? Or is this just another nutritional disaster wrapped in populist rhetoric? Today, I'm breaking down the new 2025 Dietary Guidelines for Americans line by line. I'll show you what changed, what didn't, who's behind it, and what it means for your health. The 2025 Dietary Guidelines for Americans were released on January 7, 2026. They represent the biggest shakeup to federal nutrition policy in decades. Here's what's new. 1. Red meat gets promoted. For the first time in modern history, red meat has been moved to a higher tier in the dietary recommendations. This specifically includes unprocessed beef, lamb, and pork. The guidelines now actively encourage Americans to include red meat as a nutrient-dense protein source. Previous guidelines buried red meat. They lumped it together with processed meats like hot dogs and bacon. They told Americans to limit consumption. Now, red meat is positioned as a cornerstone of a healthy diet. The justification is nutrient density. Red meat is rich in bioavailable iron. It provides zinc. It contains B vitamins, especially B12, and it supplies complete protein. The guidelines argue that previous demonization of red meat was based on weak observational studies. They claim those studies failed to account for confounding factors like overall diet quality and lifestyle. 2. Full-fat dairy is back. Low-fat and fat-free dairy products have been the official recommendation since 1980. That is no longer the case. The 2025 guidelines explicitly state that full-fat dairy can be part of a healthy diet. This includes whole milk, butter, full-fat yogurt, and cheese. They acknowledge emerging research showing no significant link between full-fat dairy consumption and heart disease. Some studies even suggest protective effects. This aligns with the Swedish cheese study discussed last week. That study showed full-fat cheese may protect against dementia. Whether that's coincidence or not is debatable, but the science may have been there all along. This is the headline grabber. The guidelines state that the decades-long campaign against saturated fat was overly simplistic. They say it was not supported by rigorous evidence. RFK Jr. called this ending the war on saturated fat during a press conference. He argued Americans were told to avoid butter, eggs, and meat. Instead, they were encouraged to eat margarine, vegetable oils, and processed carbs. He directly linked this shift to the obesity and diabetes epidemics. On the surface, this sounds like a major course correction. But there is a catch. The contradiction: saturated fat still limited to 10%. Buried in the fine print, the guidelines still recommend limiting saturated fat to less than 10% of total daily calories. This is the exact same recommendation from previous guidelines. So which is it? Are we ending the war on saturated fat? Or are we still being told to restrict it? This is where the guidelines fall apart. You can't vindicate saturated fat while still warning people against it. It's contradictory messaging, and it creates confusion rather than clarity. Seed oils still get a pass. Here's what didn't change. The guidelines still promote polyunsaturated fats from seed oils as heart-healthy alternatives. This includes soybean oil, corn oil, and canola oil. This remains true despite growing evidence linking these oils to inflammation, oxidative stress, and chronic disease. The USDA continues to endorse them. One reason may be agricultural lobbying. The soybean industry is one of the most powerful in the United States. RFK Jr. talks openly about taking on big food. Yet seed oils remain untouched. That is a notable omission. Sugar guidelines barely changed. The guidelines still recommend limiting added sugar to less than 10% of daily calories. This recommendation is unchanged. The average American consumes roughly 17% of their calories from added sugar. The same limit has been advised for years. It has not worked. There is no aggressive stance on sugar. No major reform. No war on sugar. Its absence is striking. Who's behind these guidelines? The Dietary Guidelines for Americans are produced by the USDA and the Department of Health and Human Services. They are updated every 5 years. The recommendations themselves come from the Dietary Guidelines Advisory Committee. This panel consists of 20 nutrition scientists selected by the government. The 2025 committee included several members with documented financial ties to the beef and dairy industries. Conflicts of interest. An investigation by the Washington Post found that at least 4 committee members had received funding or compensation from industry groups. These included the National Cattlemen's Beef Association, Dairy Management, Inc., and the American Egg Board. One committee member co-authored studies funded by beef industry groups. Another serves on the scientific advisory board of a dairy trade association. When scientists at Stanford, Tufts, and Columbia reviewed the committee composition, concerns were raised immediately. Dr. Christopher Gardner of Stanford called it a clear case of regulatory capture. Conflicts of interest do not automatically invalidate the guidelines, but they raise serious questions about whether the recommendations are driven by science or industry influence. What scientists are saying. The response from the independent nutrition science community has been swift and critical. At Stanford University, Dr. Christopher Gardner said the guidelines ignore decades of evidence linking high red meat consumption to increased risk of heart disease, type 2 diabetes, and certain cancers. He criticized the promotion of red meat without clear caveats about portion size or frequency. He called it irresponsible public health messaging. At Tufts University, the Friedman School of Nutrition Science and Policy released a statement calling the guidelines a step backward. They said the changes undermine efforts to reduce chronic disease. Dr. Dariush Mozaffarian pointed out that saturated fat science is nuanced. Replacing saturated fat with refined carbs leads to worse outcomes. Replacing it with polyunsaturated fats from nuts, seeds, and fish can be beneficial. The guidelines fail to communicate this nuance. Researchers at Columbia University filed a formal petition urging the USDA to withdraw the guidelines. They cited serious methodological flaws. They also cited potential conflicts of interest. The American Heart Association released a rare public rebuke. They warned the guidelines could mislead Americans into adopting dietary patterns that increase cardiovascular risk. They are particularly concerned about school lunch programs. What this means for school lunches. Federal dietary guidelines are legally binding for institutions that receive federal funding. This includes public schools, military dining facilities, federal prisons, hospitals receiving Medicare or Medicaid, and SNAP nutrition education programs. Under the new guidelines, school cafeterias will be required to serve more red meat and full-fat dairy. There will be less emphasis on fruits, vegetables, and whole grains. There will be more saturated fat. Parents are already raising concerns. In a survey by the School Nutrition Association, 68% of parents expressed worry about increased red meat in school meals. Most school lunch meat is not high quality. It is not grass-fed. It is not organic. It is often heavily processed. So while the guidelines talk about nutrient-dense red meat, children are more likely to receive low-grade hamburger patties and processed meat products. That is not necessarily a health upgrade. It is a cost-saving measure framed as nutrition reform. The red meat debate. Is red meat healthy or not? The answer is that it depends. High-quality, unprocessed red meat is nutrient-dense. It provides hemi-iron, vitamin B12, zinc, creatine, and complete protein. A 2019 meta-analysis in Annals of Internal Medicine found weak evidence linking unprocessed red meat to heart disease and cancer. The absolute risk increase was small. However, most red meat consumed in America is not high quality. It is grain-fed, factory-farmed, and often processed. Processed red meat is consistently linked to increased risk of colorectal cancer, heart disease, and early death. The guidelines distinguish between processed and unprocessed meat, but they do not emphasize quality nearly enough. The saturated fat confusion. Modern research shows saturated fat is not universally harmful, but its effects depend on context. Replacing saturated fat with refined carbs leads to worse outcomes. Replacing it with polyunsaturated or monounsaturated fats can be beneficial. Saturated fat from whole foods behaves differently than saturated fat from ultra-processed foods. Individual metabolic health also matters. The new guidelines ignore this nuance. They claim saturated fat has been vindicated, but they still tell people to limit it. Should you follow these guidelines? The guidelines get some things right. They also get some things wrong. They correctly rehabilitate full-fat dairy. They appropriately question low-fat dogma. They acknowledge nutrient density, but they provide contradictory messaging. They ignore seed oils. They downplay food quality, and they involve clear industry conflicts. What you should actually eat. Prioritize whole unprocessed foods. Choose high-quality proteins. Favor healthy fats. Limit ultra-processed foods. Quality matters more than quantity. Cook at home whenever possible. Pay attention to how your body responds. Adjust based on your own health markers. Final thoughts. The real story isn't red meat. It isn't saturated fat. It's institutional trust. For decades, Americans followed official nutrition advice. Obesity and diabetes exploded. Now the guidelines are shifting again, but they are still inconsistent, still influenced by industry, and still confusing. You can't outsource your health to government agencies. You have to think critically, look at the science, and make informed choices. Because at the end of the day, your health is your responsibility. If this video helped you understand the new dietary guidelines, like the video, subscribe for more evidence-based nutrition breakdowns, and leave a comment with your thoughts. Let's keep the conversation constructive.